Namaste everyone. My name is Pooja Sheth and I welcome all of you in this beautiful workshop on Panchakarma. Today is an introductory session where I will be giving you all an overview of the Ayurvedic treatment of Panchakarma. Now, as per Ayurveda, whenever we want to treat any kind of disease, ailment, or pain, there are broadly two ways of doing this. So, there are two types of treatments as per Ayurveda. The first treatment is known as the Shaman chikitsa, and the second treatment is known as the shodhan chikitsa. Now, let us first talk about the first one, which is Shaman chikitsa. Now the word shaman means to reduce, it means to lower. So in Shaman chikitsa, the patient is given certain Ayurvedic herbs, Ayurvedic kadhas, churnas or rasayans in order to treat and reduce the symptoms of the disease the patient is suffering from. Whereas in the second type of treatment, which is the shodhan chikitsa, in shodhan chikitsa, efforts are taken to not only eradicate the symptoms of the disease, but efforts are taken to uproot the disease right from the roots. So in shodhan chikitsa, shodhan means finding out. In shodhan chikitsa, we find out the reason, the root cause of the disease, and we remove the disease from its root cause. So that is the main difference between the Shaman chikitsa and the shodhan chikitsa. Now Panchkarma is a shodhan chikitsa. So in Shaman chikitsa, certain Ayurvedic herbs are given, some Ayurvedic medicines are given to the patient, and in shodhan chikitsa, Panchakarma is applied on the patient. Now, by now you must have understood that Panchakarma is a more powerful treatment than the Shaman chikitsa. Because many times what happens is that the patients are given the Shaman chikitsa, they are given certain medicines, they are given certain churnas, they are given certain rasayans in order to heal their diseases. Let us take an example. Supposing there is a patient who is having pain in his knees, okay? Now first through Shaman chikitsa, maybe certain natural painkillers, certain Ayurvedic medicines are given to the patient to do the Shaman of his robe, to do the Shaman of this pain. And the pain might go away also. But this going away of the pain is temporary. After certain months, again it is found out that the patient is again complaining of the pain. So in Shaman chikitsa, because the root cause of the disease is not removed, the pain or the disease keeps coming back. Whereas in shodhan chikitsa, which is the Panchakarma, what we do is we remove the root cause of the disease, we treat the patient right at the root level. Okay. So that is why we say that the shodhan chikitsa, the Panchakarma, is very, very effective, it is very, very beneficial, and it is becoming very, very popular. Because of three reasons. First, I already told you, because in Panchakarma, we work at the root level. We uproot the disease from the root level. The second reason why Panchakarma is becoming very popular is because it is the ultimate purification process. It is a process of detoxification. Through Panchakarma, we can remove and eradicate all types of toxins from our body. This is very important. See, many times we say that certain Ayurvedic herbs, certain Ayurvedic medicines we are taking, we are eating right, we are taking in all types of healthy food which should work as medicine for us, but nothing is happening. It is not showing any effect on us. Why is this so? This is so because the body is so full of toxins that these Ayurvedic medicines, these healthy food items are not being able to work on our body. Because our body is full of these toxins. So first these toxins have to be removed. Only then can the medication actually work. Let me explain this to you with the help of an example. Supposing there is a fish tank. Okay, there is an aquarium, there is a fish tank, and in this fish tank, because many fishes are living in this fish tank, The water of the fish tank has become really contaminated. It has become very dirty. It is full of toxins. Now you have been assigned the job to purify this fish tank and make sure that the fish tank is again filled with fresh water, with pure water. Now how can you do this? Can you simply do this by continuously adding fresh water? No. You first have to remove the dirty water and then you have to add the fresh water. Only then will your task be achieved. Simply adding fresh water will not help because the aquarium is already filled with toxicated water. So first purification has to be done. Similar is the case with our body also. That is why Panchakarma is beneficial, it is effective because it first works towards taking out the toxins from our body so the medicines can actually work. The third reason why Panchakarma is gaining popularity is because Panchakarma is healthy, it is good not only for the diseased person but it is also good for a healthy person. First, let us talk about the diseased person. Of course, when the person is diseased, when his body is full of toxins, when his certain organs or certain systems in his body are not functioning properly, of course Panchakarma has to be done and the root cause of the disease has to be removed. But Panchakarma is also helpful for a healthy person. When a healthy person regularly does Panchakarma practices at certain intervals of time, he is able to enhance his health. He is able to continue his healthy state of being. Just like for example, when we take a new car, we have to regularly keep on servicing. We keep giving our cars, our vehicles to service centers so that they can have a long life. Similar is the case with our body also. So that is why today we have learned that Panchakarma is helpful and beneficial not just for a diseased person but also for a healthy person to be able to maintain his or her health. So these are the three reasons why Panchakarma is very effective. It is gaining popularity. First, it removes the disease from the root cause. Second, it does complete detoxification and purification of the body. And thirdly, it is beneficial for both disease and healthy person. Okay. Now let us talk a little bit more about the process of Panchakarma. First, as the name itself tells us, Panchakarma. Pancha means 5 and Karma means procedures. So Panchakarma are the 5 purifying procedures. What are the names of these 5 purifying procedures? The first one is Vaman, the second one is Virechan, the third one is Basti, the fourth is Nashya and the fifth one is Raktamokshan. These are the names of the 5 Panchakarmas. These are the Panchakarmas. These are the names of the 5 main procedures. So these are known as these Panchakarmas. This Vaman, Virechan, Basti, Nashya and Raktamokshan. They are known as the Pradhan Karmas, the important Panchakarmas. Now before doing these important Panchakarmas, there has to be done certain Purva Karmas and certain Pashad Karmas. Just like when a patient is operated, let us say that there is a patient Mr. X who has to undergo a very critical operation. Let's say an operation of his knee, okay? Now, before this operation happens, there are certain pre-operative procedures, right? For example, maybe the doctor will investigate that what is the issue. Maybe the doctor will ask for some blood reports, some blood samples. So these are the pre-operative measures. Then the main operation takes place, and then after operation is done, it is not like the patient will start running, the patient will start leading a normal life. No, there are certain post-operative measures, which means that the doctor will give the patient certain painkillers, certain antibiotics. He will make sure that the person is eating right, he's resting well, because right now the body of the patient is weak. Just after being operated, the body of the patient is weak. So he has to follow certain post-operative measures also, right? So just like this is the case of a normal operation, similarly, even when we are doing the Panchakarma, when we are doing the pradhan karmas. Before doing the pradhan karmas, we have to do certain purva karmas and certain pashad karmas, right? So before the pradhan karma, before the panchakarma, we do certain purva karmas. What are these purva karmas? During the purva karmas, the patient is told to have a good diet. The person is given such type of food in the diet which increases their pachan, which increases their digestive power, right? Apart from this, there are certain other purva karmas which are done like snehan and shvedan. Snehan can be internal as well as external. In internal snehan, the patient is told to drink and eat certain medicated ghee, medicated oil, so that all the doshas can be accumulated properly. The snehan, these processes, the purva karmas are done to prepare the body for the pradhan karma, to prepare the body for the panchakarma. Sometimes snehan is also done externally. Externally, snehan is done by applying certain medicated oil, certain medicines, and massaging the patient's body, the entire body. So this is external snehan. This is also done to prepare the body for the pradhan karmas, for the panchakarmas. So these are certain types of purva karmas. Now after the pradhan karmas are done, after the main process is done, then the patient is also told to follow certain pashad karmas. In pashad karmas, again the patient is told to have a controlled type of a diet. The patient is asked to rest properly before before taking a plunge into the regular busy lifestyle. The patient is put under observation, and he has to rest for some time. He has to eat proper food. So all of these karmas are pashad karmas, right? So if panchakarma is important, even the purva and the pashad karmas are important. Now let us talk in details about the 5 processes, the main 5 processes of the Panchakarma, the Pradhan Karmas, which, like I told you, is Vaman, Virejan, Basti, Nashya and Rakta motion. So first we will start talking about the first Panchakarma, the first karma, which is Vaman. Okay. Now see, if toxins have to be removed from our body, there are only 2 ways. First is the upward, right, through our mouth, and the second one is the downward route, through the rectal route, right? So the first karma, which is Vaman, in Vaman we do the detoxification, we do the purification through the upward route, which is through our mouth. So in Vaman chikitsa, in Vaman procedure, certain medicated grits, which is ghee, medicated oils, certain medicated herbs are given to the patient in order to induce vomiting. Okay. So this vomiting, it is not like this vomiting will continue for a long period of time. This is continued only for a short period of time, and it is controlled vomiting. This vomiting is done in order to accumulate all the toxins and flush them out through the upward route. So this is the main objective behind the Vaman. Now, what types of diseases are cured with the Vaman chikitsa? Through Vaman, mostly all diseases related to cough. There are 3 doshas, right? Vat, Pitta and Kapha. So those patients who are suffering from cough related disorders, which means that if someone is overweight, they are suffering from obesity, or they are always feeling very lethargic, they are feeling very lazy, there is swelling, there is stiffness in the body. So all of these type of issues which are primarily kapha related. Even at times we say that certain patients who are suffering from certain types of heart condition, even they can be cured through Vaman. So all the diseases related to kapha, the kapha pradhan rog, are cured with the process of Vaman, which is induced and controlled vomiting to flush out the toxins from the upward route. Now I told you that even healthy people can do these panchakarmas, right? So when a healthy person has to do Vaman, then he has to do this during the Vasant Ritu.